I may decode. Welcome to MedDecode.
Hello and welcome back. For this deep dive, we're tackling something that honestly hasn't gotten nearly enough airtime in perinatal health talks. We're talking about paternal perinatal depression, PPD.
That's right. For so long, the focus has understandably been on mothers, which is critical, of course. But there's this whole other side to the story. We now have some really comprehensive research, a big systematic review, a JAMA patient page showing we've basically been missing half the picture.
It feels like that, doesn't it? Decades standardizing maternal care. But fathers, they're going through this huge life shift too, often. Wow, without much of a mental health safety net at all.
Exactly. So our mission today really is to drag PPD out into the light. We want to unpack the specific ways it shows up in dads, which can be different, and look at the ripple effects, on the whole family, and crucially, why catching it early is so important, not just for the father, but as we'll see, for the child's development too.
And the numbers here are genuinely surprising. This isn't some rare condition. We're looking at about 10% of fathers worldwide. 10%. 1 in 10.
Just to think about that for a second. 1 in 10 new dads grappling with a clinical mental health issue during maybe one of the most stressful transitions of their lives.
It's absolutely a common challenge, and it needs our attention. So just to be clear on the definition, PPD refers to depressive symptoms that can pop up either during the partner's pregnancy, that's the antenatal part, or, and this is key, during the first year after the baby's born, the postnatal period.
Right, that whole window, conception through year 1.
Yeah.
It's just intense, a period of massive vulnerability for both parents.
Okay, let's unpack this. When most people hear depression, they probably picture, the classic signs. Persistent sadness, maybe trouble sleeping, loss of interest, that kind of thing.
And fathers with PPD can absolutely have those symptoms. The fatigue, the anxiety, finding it hard to concentrate, those are often there. But, and this is the crucial part, how it looks on the outside can be really different in men compared to the typical maternal presentation.
That difference sounds like the core reason it gets missed so often. It absolutely is. It's the crux of it. A father who's struggling deeply might not come across as obviously sad or withdrawn in that classic way. Instead, what we often see, the symptoms that are more common in fathers, they tend to be, externalized, like acting out the distress rather than internalizing it.
Okay, so what does that actually look like? What are these sort of hidden markers maybe that clinicians or even family members should be aware of?
Yeah, the sources are pretty clear on this. Instead of or alongside sadness, you often see high levels of irritability, sometimes outright anger.
Anger, okay.
Yeah. And instead of maybe retreating inwards, you might see avoidance behaviors, like throwing themselves into work longer hours, maybe as a way to just not be there physically or mentally, or, increase screen time. Zoning out.
Distraction.
Exactly. Distraction and avoidance. And importantly, this period often sees an uptick in drug or alcohol use, kind of self-medicating, trying to cope with the distress that way.
So that's the real insight, isn't it? If you're only looking for sadness and crying, you might just see a guy who seems stressed out or grumpy or suddenly a workaholic. You completely miss the clinical depression underneath. The whole system is almost set up to miss it.
Precisely. These behaviors, the anger, the burying himself in work, they're often dismissed as just, poor coping skills, or he's just stressed, it's a new baby. They aren't always recognized as signs of a treatable mental health condition. And this masking, it kind of protects the father from feeling vulnerable, maybe, but it also cuts him off from the support he really needs.
Right. Which brings us to why this isn't just about the father's own struggle. It's a public health issue because, as the sources show, PPD really does impact the entire family.
Oh, the ripple effect is huge. You see it immediately in the couple's relationship. PPD often leads to more conflict, more stress between the partners, which, puts a massive strain on how they co-parent. And what's more, a father's mental distress actually significantly bumps up the risk of the mother developing postpartum depression, too.
Wow, so it can compound the problem.
Definitely. It puts this incredible strain on the family's emotional and practical resources.
And then there's the direct impact on the baby. If the father is struggling, maybe withdrawn or irritable, that connection, that bonding, it suffers.
Yes. And this is where that big systematic review and meta-analysis gives us that real aha moment. This wasn't a small study. They pulled together data from, 48 different cohort studies?
48. That's massive.
Huge. And they look specifically at the link between paternal mental distress, so depression, anxiety, stress, and how the children developed later on.
Okay, so what did they find? Which areas of child development seemed most affected by the dad's mental health during this perinatal period?
Well, they found a consistent, albeit small, association with poor development across several key areas: overall global development, cognitive skills, language development, even physical development.
Physical development, too. That's surprising.
It is. But what's fascinating here is the evidence was particularly strong, really compelling, for negative impacts on the child's social emotional development.
Ah, okay.
Yeah, we're talking about things like kids being more likely to show internalizing behaviors like anxiety, or externalizing ones like aggression, or just more negative affectivity overall. These are areas really shaped by those early back and forth interactions.
That makes a lot of sense, actually. If a dad is checked out because of work, or maybe quick to anger, those sensitive, responsive moments that really build a child's social and emotional foundation, they're just not happening as much, are they?
Exactly. It really highlights how powerful that early social environment is. It's also really important to mention the review specifically found no link between paternal distress and the child's adaptive skills or motor outcomes.
Okay, so it's quite specific.
Yes, that specificity kind of suggests the impact is really concentrated in those psychosocial areas. It reinforces that it's about the quality of the interaction, perhaps more than just general health factors.
Now, there was another really critical finding in this research, wasn't there? About the timing of the father's distress.
Yes, this is absolutely key. The review found that the negative associations with child development were generally stronger when the father's mental distress was measured after the baby was born postnatally compared to during the pregnancy, the antenatal period.
Okay, stronger after birth. What does that tell us?
Well, it's a huge clue for prevention, right? It suggests that maybe the father's mental state has a more direct or perhaps more potent influence on the child once the baby is actually here. It could be through disruptions in his responsiveness, maybe emotional withdrawal, or just being less able to effectively support the mother during that really demanding first year. It really pinpoints the postnatal period as this incredibly sensitive window for intervention.
So if the impact ramps up after birth, that really underscores the need to identify struggling fathers and get them help in those crucial first few months. The clock is ticking, in a way. Knowing that, who are the fathers we should be most concerned about? Who's most at risk for developing PPD?
The risk factors are often things you might expect, common stressors, but they can combine in a way that just overwhelms coping strategies. A big one, obviously, is a personal history of depression. That puts fathers at significantly higher risk.
Makes sense.
Beyond that, it's often the cumulative effect of typical new parenthood stresses. Things like serious sleep deprivation, which we know messes with anyone's mood. Financial worries are huge. Relationship stress.
And how do those specific stressors tie back to the anger and avoidance we talked about earlier?
Well, think about it. Chronic lack of sleep naturally makes anyone more irritable, right?
Definitely.
Add major financial pressure, and maybe the father feels this intense obligation to work even more hours. So you get this cycle where the risk factors like money stress, sleep loss directly feed into those specific externalizing symptoms, the irritability, the withdrawing into work, which then makes the underlying depression harder to see, and just the general difficulty adjusting to this massive new role of father. It just piles on top of everything else.
It paints a picture of how easily it could spiral. So given that the symptoms can be masked and the risks are clear, how do we actually get better at identifying and supporting these dads? Early diagnosis and education seem vital.
They really are. And the good news is clinicians do have reliable screening tools they can use, although it's worth noting screening often doesn't happen until maybe 3 to 6 months after the baby's born. We can actually adapt tools often used for mothers, like the Edinburgh Postpartum Depression Scale, the EPDS, or the Patient Health Questionnaire, the PHQ-9. Those are pretty common.
But hang on, if those tools are mostly designed to pick up on sadness and withdrawal, how good are they at catching that anger and avoidance pattern in men?
That is a really important point and a potential limitation. Which is why another tool, the Gotland Male Depression Scale, or GMDS, is also relevant here. It's specifically designed to better capture those externalizing symptoms, the anger, irritability, even physical complaints or substance use that the standard scales might miss. So using the right tools and interpreting them correctly is absolutely key.
Okay, so let's say a father is screened and identified as struggling. What happens next? What kind of support is available?
It depends on the severity, of course. For some fathers with milder symptoms, just having good social support family, friends who understand might be enough. But often, Connecting with other fathers is incredibly powerful. Things like paternal support groups, whether they're in person or online, just sharing experiences, realizing you're not alone in feeling this way, that you're not failing, that can be hugely validating.
I can imagine reducing that isolation.
Exactly. But if the symptoms are more severe, if they're really impacting his quality of life or his ability to interact positively with the baby or his partner, then professional help is definitely needed.
And what does that professional help typically involve? What are the treatments?
It generally follows the standard pathways for treating depression. Psychological therapy, like cognitive behavior therapy, CBT is often a first step. CBT can be really effective in helping fathers learn skills to manage those difficult thoughts and those externalizing or avoidant behaviors. And in cases where symptoms are quite severe, antidepressant medications, like the SRI's serotonin reuptake inhibitors, might also be considered by a clinician. The ultimate goal, as all the research underscores, is getting fathers connected to the right support for them, because doing that leads to the best mental health outcomes for everyone involved, the father himself, his partner, and crucially, the child.
So what does this all mean? Let's bring it together. We've seen paternal perinatal depression is common, that 1 in 10 number is stark. It often hides behind anger or distraction, things like working too much or too much screen time. And now we have really strong evidence that a father's mental distress is a predictor of their child's development, something we can potentially change, especially impacting social-emotional skills, and particularly in that critical postnatal period.
Absolutely. That finding that the link is stronger after birth really suggests that investing in dad's mental health during that first year isn't just nice to have, it's a vital public health strategy for the next generation.
It shifts the whole conversation, doesn't it? From just focusing on supporting the mother, which remains essential, to recognizing that the father's mental well-being in that sensitive postnatal time is actually central to the child's healthy development and the whole family's stability.
It really is. You could almost say if we treat the father's mental health challenges, we're directly treating the child's early environment.
So here's the final thought we want to leave you with, something to mull over. If that postnatal window is so critical for child development, and if PPD in fathers is often masked by things like working longer hours, how are our current systems actually failing fathers during this incredibly sensitive time? Think about healthcare pathways that barely acknowledge dads, workplaces with inflexible leave policies, maybe even societal expectations.
Right. And what proactive changes, what investments should we be making as a society to better protect the mental health of new fathers? Because as we've seen, doing that is fundamentally an investment in the health and well-being of the next generation.
And that's a wrap on this episode of MedDecode. I really appreciate you joining me today. If something we talked about sparked your interest, or if there's a medical term that's been bugging you, let me know in the comments. And if you enjoyed this, be a pal and share it with a friend. We'll catch you on the next one.